Okay, I think we'll go ahead and get started today. So I just want to say welcome everyone for being here. My name is Megan Waters. I work as a development and communication specialist at ECDC African Community Center, and I am also part of Colorado Refugee Connect, the convening organization for today. Over the last few years in Colorado, there has been a significant expansion of refugee mental health services in order to meet the needs of our growing newcomer populations. We've heard that many people feel burnt out and that they lack awareness of resources. So, Colorado Refugee Connect has convened this webinar to increase awareness of some of the incredible programs that provide mental health and wellness support to newcomers in our community. We will be recording this webinar so that we can share it afterward, but please note that recording will be stopped before the Q&A section to protect the privacy of attendees. For those who don't know, Colorado Refugee Connect is a collaborative project that includes the International Rescue Committee, Lutheran Family Services Rocky Mountains, ECDC African Community Center, and the Colorado Refugee Services Program. Colorado Refugee Connect's mission is to create a flourishing Colorado by connecting refugees and receiving communities through opportunities to learn, engage, and celebrate. We also facilitate the Colorado Refugee Speakers Bureau, which uses storytelling and speaking engagements of all kinds to create connection and understanding between refugees and the wider community. So for today's webinar, we'll begin with an overview of Colorado's refugee mental health landscape from the State Refugee Mental Health Coordinator, Jan Jenkins. Then we'll move into brief presentations from the 4 mental health partners joining us today. These include the Village Institute, which is a holistic family support center for refugee and immigrant families in Northwest Aurora. Through their work, they bring family advocacy, resource navigation, career readiness training, early childhood education, and mental health services, all under one roof. Muslim Youth for Positive Impact empowers youth with Islamic identities to make a positive impact in their communities. MYPI has been a hub of Colorado's African welcoming and response. Our third mental health partner, the Creative Exchange, is a refugee serving partnership between 2 organizations, DiversifiED and Imagination Celebration. Together, they use creativity and the arts to build skills, integration, and community. And our last mental health partner and presenting organization for the day is the University of Colorado's School of Medicine Immigrant and Refugee Mental Health Program. Their work spans from outpatient mental health services, parenting and sleep workshops, to substance abuse, education, and more. We'll have time for about 10 to 12 minutes of Q&A after the presentations are over before we wrap up. The chat will be enabled throughout the webinar, but we are please requesting that questions be sent through the Q&A function of Zoom. Please be sure to mention which presenter you are directing the question to, unless it's a question for everyone. Now, to start off our session, we will hear from the State Refugee Office, the Colorado Refugee Services Program. Jan Jenkins is the State Refugee Mental Health Coordinator and has really led Colorado's efforts to develop a holistic and diversified set of mental health resources for refugees. Please welcome Jan.
Hi, everybody, and so glad that you could be with us today. As Megan just said, I'm the State Refugee Mental Health Coordinator, and I am in the Colorado Refugee Services Program, which is located within, go ahead to the next slide, please. Yeah, within the Office of New Americans. And that is within the Colorado Department of Labor and Employment. The Office of New Americans' vision is that all new Americans have equitable access to opportunity and well-being. And its mission is to facilitate the integration and inclusion of new Americans into Colorado's civic, economic, and social life. In terms of refugee mental health, some key areas CRISP oversees include the initial refugee mental health screenings as part of the domestic medical exam and mental health and wellness grants. Colorado's refugee mental health services are among the most robust in the country in comparison to other states. This is true from the initial refugee mental health screenings through the number and diversity of refugee mental health programs, and also includes being among the few states with a refugee mental health coordinator able to concentrate solely on enhancing refugee mental health. Contributing to the largest expansion of refugee mental health programs funded through CRISP ever was the fact that the Office of Refugee Resettlement, or ORR, expanded its financial investment in refugee mental health and provided additional funding specific to Afghans and Ukrainians. Also helpful was the strong network of refugee mental health and wellness organizations which already existed and was able to collaborate to develop and implement expanded programming. Within the past 3 years, more than 16 mental health and wellness programs have been supported through CRISP with ORR funding. Mental health services were also added as a facet of the Thrive services through CRISP, which assist in refugee integration across the first 5 years after arrival. The programs highlighted here today are supported through the Refugee Integration Fund, a collaboration between CRISP and the Rose Community Foundation. There are also other types of mental wellness programs supported through CRISP, such as family stabilization support and youth mental health evaluation programs, which we will not be discussing today. Information regarding all of the mental health and wellness programs and ways to refer to them can be found on the ONA website indicated on this slide. Colorado is also very fortunate to have some excellent refugee mental health service providers in addition to the programs funded through CRISP. A number of them are listed in a shared folder, which can be accessed through the link indicated on this slide. The priorities which were set for funding community partners for the Refugee Integration Fund grants were to encourage a wider array of applicants from more geographic areas, serving varying populations, and offering diverse types of programs. We also wanted to encourage smaller community-based organizations to apply, which were already doing great work in the community serving refugees, but had not received federal funding. To make this feasible, we were able to offer the necessary technical assistance to support them in developing the infrastructure and processes to succeed in meeting federal funding requirements. The goals of these grants, per ORR guidelines, were to decrease social isolation and stigma associated with mental health. Community programs are central to accomplishing these aims, as they have been able to address the stress and isolation newly arriving refugees frequently experience, which helps mitigate against escalating distress, which may require specialized mental health intervention. The programs have in common an emphasis on prevention and early intervention where possible, utilizing strengths-based approaches. Collaboration across organizations to decrease the siloing of resources and to strengthen the network of service providers has also been encouraged. I'll turn it over to Megan at this point. Thank you.
Thank you, Jan, for that wonderful overview. We'll now begin with presentations from our key providers. Our first two presenters are from the Village Institute. Please welcome Ellie Edelman, their founder and director, and Claudine McGeisha, the Village Futures Program Coordinator.
Hi, everyone. It's so good to be here with you today. I'm Ellie Edelman. I'm the executive director at the Village Institute. On the next slide, I can share a little more about who we are. We are a holistic family support center for refugee and immigrant families in Northwest Aurora, particularly for single mom and other female-led families. As Megan mentioned, we provide a number of different services and resources under one roof as part of our mission to cultivate a multi-generational ecosystem which uplifts the power of refugee and immigrant families and brings them closer with their neighbors. We have two primary programs. The Little Village, which we're not going to talk much about today, but this is our Diverse by Design Montessori style early learning program. All of our teachers come from newcomer and first gen backgrounds themselves. There's 7 languages spoken on our staff at the Little Village, and we work with kids currently age 1 and up. Starting next year, we also will have an infant room and be able to provide services starting at 6 weeks. And if you have questions about that, the email address is here, littlevillage@villageinstitute.org. Feel free to visit our website for more info on Little Village. On the next slide here, today we're going to talk to you more about our Village Futures program. This is our teen and young adult program. And the overall focus of the program is mental health, and that includes career development for mental health and social services careers, as well as peer support and mental health support for young people from refugee and immigrant families. You can see some of the stats there on the program and who it serves. We'll walk you through the different components. So I think Claudine will talk you through this first component of our program.
Yeah. Hello, everyone. Thank you, Ellie. My name is Claudine, and I'm a program coordinator at the Village Institute, and happy to share about our programs, talking about the wellness workshops. This is a 6 weeks affinity-based wellness groups, and these groups help students come together and discuss about holistic mental health, talking about the physical, the emotional, the spiritual, and the social aspect of what it is to be healthy as a young person. And mostly we tend to work with the age 15 and above. We've been having the groups for teenagers and the groups for young adults. These young adults, most of them are single moms, and get to talk about also the issues they experience as a single mothers from Africa and the cultural component of that. And we also support with transportation for them to come to our programs. We provide food and sometimes incorporate dance and fun so that they can feel belonging and feel home. And the next group is gonna be for Afghan, and it will be at Village Institute. And if you want to know more, you can reach out to us via the email here at the slide. Thank you.
Another component of the Village Futures program is My Health Future, which is our 25-hour career exploration program. And this is the piece that's focused on mental health, social services, and other healthcare career opportunities. This is also for students age 15 and up. We tend to focus on kind of juniors, seniors, and then we will sometimes also provide this for early college age students or students who are taking a break between high school and professional training. They get to learn a lot of different types of careers. So it's really about exploring the different career opportunities that are available in the wellness field. And they'll go on field trips, they meet professionals from the field, they gain some kind of basic job readiness skills in terms of resumes and interviewing and networking and those kinds of things. This is a stipended program where students will receive up to $400 for participating in the full program. And this program, at this point, we generally provide through partner organizations where we'll go into a school or a housing complex and work with students who all come from that community. And so if you'd like to partner on a future cohort and provide this kind of career exploration opportunity to students in your organization, your school, et cetera, definitely feel free to reach out. And if you are a professional in the field and would love to serve on our career panel, we'd also love to hear from you.
And then we do have our Village Cafe monthly. It's a monthly teen social active event. It usually happens at the Village Institute from 4 to 7 p.m. We had our last one on December 6th for the 2024, and it was clothes swapping. It was fun, and the objective of these village cafes is to have all the young people from our community to come and just connect and share culture, share different values that they carry as heritage from their roots, their countries where they came from, and just feel happy and dance and learn together. There's always meals, and we always provide transportation to make sure everyone has the chance to participate. And our next is going to be on January 10 because the January 3rd will be off. So, but resuming February being the first week of the month. And for more information, you can always reach out to the Village Futures at thevillageinstitute.org. Thank you.
And then the last piece of this program is that a majority of our programming is peer-led. And so we hire largely students who come from our programs who've been participants, but increasingly we're also working with partners to help recruit for peer facilitators. And we will be recruiting for 2 new facilitators in 2025. I know the team is interested in potentially hiring a male facilitator or 2 so we can reach more young men through the program. This is a paid 6-month opportunity with the option to extend. We often have students stay for a year or more as a peer facilitator. And this program, we really provide a lot of training and wraparound support, knowing that this is often young people's first job or first really kind of community leadership type experience where they're being paid. And so we do a retreat at the beginning of the program to get facilitators all kind of connected and provide some of that initial training. And then they receive a lot of on-the-job training and development and leadership opportunities and that kind of thing within the organization over the term of their peer facilitator tenure. And so we'd love to hear from you if you are one of these people or if you have amazing young adults that you're working with who you think would be a great fit for our peer facilitator program. That's it. Claudine, any last things you want to add about your program?
No, thank you for listening, and we like collaboration, so we can't wait to hear if you have interest in our programs or if you feel there's a potential collaboration we could work on together. We'll be happy to hear from you. Thank you.
Thank you so much, Ellie and Claudine. We're excited to welcome our next presenter, Homa Baba Kibadi, the Executive Director of Muslim Youth for Positive Impact.
Bismillahirrahmanirrahim. Thank you, and good afternoon. I think it is afternoon now. Yes. to everyone. It's such an honor to be here amongst all the incredible panelists. Thank you, Lee and Claudine, for that beautiful presentation and for all the incredible work that you do. And everyone today that has joined, it's powerful to be in the same virtual room with all of you. Like Megan said, my name is Homa Babaki Badi, and I'm the founder and executive director of Muslim Youth for Positive Impact. I'm so excited to talk to you a little bit about like who we are and how we kind of came about and what issues we saw facing our community and what solutions we kind of put forward. So, and then just thinking about collaboration and how we can all be a community and village to support one another and serve our communities. As you see, our mission for MyPi and our vision is to impact to empower youth to impact the world. So we really take a holistic approach to our programming and providing youth opportunities and support so that they can serve themselves, their relationships, their community, and and their family, and make that that difference in the world. And in the next slide, you see just a I know the pictures are pretty small, but I wanted to let you know that there's a lot of more people. You can see like a full group behind me of all the incredible individuals that are part of this this mission. We're grateful to have a lot of youth that are the voices of our community. We are a grassroots organization that started in 2018, and our staff, everyone's very close in proximity to the community that we serve. And like Ellie said, a lot of those who were within our program are now serving and supporting others. And then the next slide, you'll see that we have 4 main programs within MyPi. We started with our mentorship program, and I'm originally from Afghanistan, and I came here when I was in middle school. So really looking at when I was in college, I saw that my younger siblings were going through the same difficulties and facing the same challenges that I was facing in middle school and high school. So one of the main reasons that MyPi came about is because of this mentorship program. I was mentoring, teaching Sunday school for about 17 years, and I was a pretty young teacher. So 17 years, I don't want to age myself, but just working through that incredible community building in that classroom. It was wonderful to have that mentorship program. And then from our mentorship program, we developed our mental wellness program, which you'll hear some more about. We also through that worked with, provided opportunities for our youth to be able to work with refugee communities as like giving back to the community. So our adoptive family program came about. And then we have our career and academic development program to help youth reach their full potential with pathways to success. And in the next slide, you'll see of like for us to really put in the programming, like I spoke about, a lot of our youth face a lot of challenges, a lot of discrimination. And since when I was going through middle school and high school, when I came from Afghanistan, I didn't know the language, trying to navigate the culture here and the systems. And that journey was just really, really difficult. So now when we see like like when the influx of Afghan refugees happened, there was a lot of issues, and I see like these youth, and I we see how their struggles are still very similar to what we had to struggle in coming to the United States. And because of the discrimination, because of the lack of belonging that they may feel within their communities, it's just been very challenging. And so when we think about our programming, we really focus on these studies that have been done, and then just experience to see what kind of programs we put forward. So in the next slide, as you see, we found in the studies that really giving youth a sense of belonging, giving them a safe space, focusing on supportive, like how to support their families. And then in a community, we developed our adoptive family program, working with the refugee families, and then collaborating internally with our mental wellness program. We picked like 4 main goals for our mental wellness program, which you see in the next slide. And that's one, we combating stigma. There's a lot of stigma, as you all probably know, within a lot of our communities. And so for the within the Muslim community, we try to combat that and try to talk about that. And after combating the stigma, we work on building trust. with faith leaders, with parents. We work with mosques that we, reach out to, and our ambassadors and families, and then our service providers. Once building that trust, we've been able to provide access. And 2024 has been really our year where we can, we say that like 2 years ago, combating stigma, we're still combating stigma. We've built that trust, and now we're providing access to our community. And then finally, using like art and writing as a means of identity empowerment and coping skills. And within these, we've been able to build our mental wellness house. And we've been able to work with service providers and that are culturally competent. And you'll see some faces in a bit, but working to provide individual therapy, to couples therapy, family therapy. And then we have, our workshops, and then we have like one starting place. So like there's a link there, and I will share that link right after the presentation, the mental wellness intake form. And from this intake form, you can connect with our service providers in this next slide that you see. We've built, these are the incredible individuals within our community that we've been able to connect with and able to refer to in providing services. I would also love to let you know that within the staff and the providers, we have 11 different languages that are spoken. And so we can do bilingual services as well. And then we have just different array of expertise. We also have certified life coaches that we seek support with. And the next slide, you'll see that we have some additional programming. So we're very, very proud and grateful to be able to add a family stabilization support program this year. And making it stronger for 2025, as we've seen a lot of need within the community where the family stabilization program has been needed. And like Ellie talked about the peer-to-peer, we saw last year that our peers, our youth, they want to talk to other youth. So we're working on getting our staff and our peers trained to be life coaches, to be those who, the youth can depend on and talk with within that. In the next slide, you'll see just a simple kind of comparison of what our 2022 looked like with our 2023. We're in the process of developing our 2024 impact card, and we're so grateful to see that our programs are actually combating stigma, are breaking stigma, shattering that stigma to be able to offer and allow our community to seek those mental health services. And then we, like I said, we took a holistic approach. So within our adoptive family, we have a lot of workshops, parenting workshops, we have food relief services, we have just support groups. So allowing the community to feel home when they're away from home, and to allow them a place of belonging, and providing the youth that confidence in their identity. So yeah, I'm really looking forward to connecting with all of you, and I appreciate everything that you all do. And yeah, if you have any questions, I know you can ask later. So I'll leave it at that. Thank you, Megan.
Thank you so much, Homa. For our next presenters, I'm pleased to introduce from the Creative Exchange, Luis Eliafori, founder of DiversifiED, and Deborah Thornton, founder of Imagination Celebration.
Thank you everyone for being here with us today. And to just echo Homa's statement, we are so grateful to Colorado Refugee Connect and for everyone here on the call today. The Creative Exchange is a collaborative effort between DiversifiED Consulting and Imagination Celebration. And I would say that there's a third partner in there being our volunteers, because none of this would be possible without our fleet of volunteers that transports individuals back and forth between services. And DiversifiED Consulting has 20 years experience in welcoming and in newcomer integration, and Imagination Celebration has 2 decades of experience working in the arts and in community. So together we're able to create spaces of welcoming and expression. Our services are designed to really center community. So the heart of everything is community. And through community, we're able to work toward resilience, work toward self-efficacy, work toward connection in the community. Our services are very tailored. One of the things that we heard from Jan is that idea of building collaboration within networks. We are located in the Pikes Peak region. So the Pikes Peak region has tons of great, amazing things going on. However, the networking part of that is still very much in its infancy. It's not a Denver metro type situation. So while some of our peer organizations have been doing this work for many years, that overlap of sharing resources, sharing ideas, sharing services is still pretty new. So that's one of the areas that we're really working to develop that's really central to our program. The other part, true to our name, is the idea of exchange. So everything that we do is a give and forth, a back and take, an exchange of ideas, of information, of language. So it's not just us putting our thoughts and ideas on our participants, but also receiving from them. So what you might hear, what that looks like is in our sessions, you might hear them teaching us a Daria Pashto word as they're also learning English. This usually generates some giggles and laughter as our attempts are something to be desired. However, it can also look like we start every session, say, with tea and cookies and time to be together and communicate and just be. And some of our clients will bring foods or bring textiles, things that they've sewed, things that they've made, things that they've cooked in, and we'll have time to share about that and what that means, what the history behind that is, so that we can also learn and grow alongside. This builds trust, of course, but in getting sort of the messaging of folks existing within our community and being a part of our community outward into a city and an area that isn't as familiar with newcomers as, say, the Denver metro is. We can go ahead and continue. We have two key programs in the imagination space. The first is Imagining Possibilities, which is about to start, and that looks at ESL, it's job training and employment and entrepreneurship opportunities. This particular program is through RIF, and I will say, as Jan was mentioning, this integration fund in collaboration with Rose, one of the big pieces that came out of that was that there were some smaller organizations that were given a chance, that were given an opportunity to step forward. And I think that's been really impactful and made a difference in this, and obviously given us a chance to be able to do what we do. So the Creative Exchange is a therapeutic arts program. It's designed to support folks as they're integrating, but also as they're working through socio-emotional well-being. It is open to any ORR eligible member. We have folks that are not, and we still welcome those individuals as well. They're just sort of serviced in a little bit different way. So right now our programming really focuses on Afghan women. We are expanding that to include Afghan men as well. We are actively recruiting Ukrainian, Cuban, Haitian, and other ORR eligible populations in the Pikes Peak region. Finding and recruiting those folks is a challenge because that network, again, is still in its infancy. So if you have folks that you would like to refer to us, we are happy to have those conversations. This project really works to minimize isolation, foster creativity. We take sort of a collectivist lens to therapeutic programming, and that we're working together. And so that kind of having some opportunity, as Homo was mentioning, to break down that stigma, to build trust, and then to have some conversations that come out of that. So we work in a collectivist approach, but if individuals need specific supports, we can refer those out to organizations that have the expertise to handle that. English is embedded in all parts of the programming, and that drive, that desire has sort of led to the need to create other sorts of programming that continue on with that, because there's a real need for English learning, a desire within. Materials, of course, are available. We do programming. Programs are led daily by our therapist, co-taught by our cultural navigator and our program manager, and then of course with the volunteers on site. We very quickly realized that it was absolutely impossible to have programming for Afghan women without having parallel programming for youth. So we do have that parallel program set up in which youth also receive a therapeutic arts exploration program, and the wellness program is where our adult women receive their services and join our community. I'm going to let Deborah continue on. She's going to talk about the impact of this and what that looks like in the day-to-day operations.
Thank you, Louise. Imagination Celebration's been a nonprofit serving the Pikes Peak region for 20 years, but we've actually been serving the area for 35. And in the last 5 years, we've really done a lot of work with programs that address mental health. We have a program that has served military returning from a war zone with PTSD. We've been serving people with Parkinson's. We have an ongoing theater program for people with developmental disabilities and physical disabilities. So we were really, really so appreciative to be part of this program, recognizing that we may not be seen as a traditional participant, but definitely there's science research that shows the value of creative engagement in helping with mental health. And so bringing these women together has been so essential for us. And we did see that the National Resource Center for Refugees, Immigrants, and Migrants talked about that the #1 protective factor for Afghans addressing mental health is social engagement and community building. I have a friend, Dr. Salar, who fled from Herat to Canada, and he's done a training for our Afghans here with medical interpretation, working with some of the husbands and wives that have been part of our program. And he said something very meaningful recently. He said, "We have been welcomed here in our village, but we haven't been taken in." And what I know is that these women feel taken in. I wish you could hear them. There's about 40 women in the other room, and there's so much laughter and joking that goes on. One of the women had lived here for an entire year, and the only place she went was to the grocery store. And during that year, she never met another Afghan or an American. She only did transactions at the grocery store until she walked into our site. And so she just 3 days ago helped welcome new Afghan women that are coming to our region. They've become basically ambassadors for the people in our region that are newcomers. So we've seen the value of building that community together. And what's great is that the women are inviting their friends. They've made friendships with women across tribes. There's just, like we said, there's nothing to replace the laughter and joking that we hear in that transformation in the women. The husbands are supportive because they know their wives are happy. We've had children that are part of the program that were melting down when they first started, and now they are thriving and learning to play with each other. One of our most exciting accomplishments recently was that the women helped create an exhibit at the university at the INT Center through the Gallery of Contemporary Art. And we had thousands of people coming to see that exhibit. The Afghan women felt very valued, being seen, and it built a lot of new relationships. And we won the People's Choice Award. So we know that by bringing them together, you can see in this slide, they're actually out in front of the Art Center because we have our clinical therapists working with them each week on using lots of different ways to help relieve stress. So we take them out to play in parks. This was their first time to even experience an art center. And you'll see some of the beautiful items that they have started making for us. I'm wearing some earrings. Here's one of their traditional Afghan clove tassels that they've made that was part of the exhibit. And I would say that the relationships that have happened among the volunteers with the Afghan newcomers is what's made this so effective. It's definitely one of the best practices, is that these women, these volunteers, go and pick them up every time, take them home, and while they're traveling with them, they're informally practicing English along the way. So our women, our volunteers are essential. Our cultural navigator is essential. Not only does she speak Dari and Pashto in English, but she has great wisdom in addition to her skills. So we're very appreciative of all the people that are part of this program, and we welcome you to come and be part of it. You can contact us through our emails. Thank you, Megan.
Thank you, guys. Thank you both. So now we'll move on to our last presenter, Fardous Ahmed, LCSW, and a senior instructor in the Department of Psychiatry at the University of Colorado School of Medicine. Fardous is also a clinician and the Associate Program Director of the CU Medicine Refugee and Mental Health Program. Welcome, Fardous.
Thank you so much, Megan. I appreciate it. Thank you for having us today. This is a great opportunity to learn all the mental health resources available for our refugee and immigrants community in Colorado. If you can go to the next slide. I'm going to talk about our program. I know there's a lot of confusion sometimes that people, where is your clinic located? Is it the UC Health or CU Medicine or University of Colorado? So the Immigrant and Refugee Mental Health Program is outpatient behavioral health program that provides evidence-based clinical care. And it is located within our Department of Psychiatry at the University of Colorado School of Medicine and its campus here in Aurora. It is also part of the CU Medicine and UC Health outpatient system care. Our mental health services and practice are deeply informed by the latest research, including studies conducted by our faculties and clinicians at the University of Colorado School of Medicine. We prioritize trauma-informed and culturally competent approach, ensuring that our practice are not only evidence-based, but also sensitive to the unique experience of individuals that we serve. That includes refugee and immigrants community. For the more than 25 years, our clinic has provided a higher quality and culturally sensitive mental health support to refugees from over 30 nations. The services that we provide range from clinical services, education and training, and community outreach. I will talk about details in a minute. Thank you. So the services that we offered are both in person and through telehealth, ensuring that accessibility for all participants. We also do e-consult, and what that means is to email consultations as well as phone calls, conference calls, and meetings. If the providers wanted to discuss cases that they're referring to us or need assistance with a specific case that relates refugee mental health services. We do this with the CRIPS mental health team, as well as refugee resettlement staff. They can reach out to us through email. It's case by case for consultation before we proceed for the referral. So who do we serve? Immigrant and refugee asylee who lives in Colorado. Our age group includes, 0 to 18 years old and adults. The insurance that we accept includes Medicaid, Medicare, and limited other insurance plans. Unfortunately, we do not have sliding scale or pro bono services for uninsured individuals. We receive a lot of referral from the community, individuals who do not have insurance, even though we do not, have except uninsured, we do refer to the community providers that have services for them. Next slide, please. Our team includes psychiatrists, social workers, professional counselors, psychologists, faculty, cultural navigators that highly skilled, culturally informed, have a years and decades experience working with immigrant refugee population. Our team also have a refugee and immigrant backgrounds. Our clinician speaks a variety of languages that includes Spanish, Arabic, Somali. We also do have a cultural or patient navigators that speak Dari, Pashto, and Farsi. Next slide, please. So our clinical services include psychiatric evaluation, that includes diagnosis and treatment plan, medication management, clinical consultation to healthcare providers, psychoeducation. Our psychotherapy program includes individual, couples, families, and group therapy. We do provide refugee mental health screening and youth mental health evaluation. If you have any questions of those specific programs, I will talk about at the end. Next slide, please. Our care coordination services assist individuals and families in accessing mental health care and resources. That includes mental health navigation services. This is limited to only Afghan clients in our clinic. And we only have, that is because we only have Afghans that speak Dari and Pashto and other languages among that population. We also, connect our clients to the resources that are available in the community. That includes navigating healthcare system, scheduling appointments, transportation, and other resources, basic needs. Next slide, please. So our training program, as a part of the CU School of Medicine, Department of Psychiatry's Standards of Education and Training, our clinic provides a comprehensive clinical training and education to a variety of professionals. This includes workforce development programs for psychiatry residents, child psychiatry fellows, social worker psychologists, and interns from other mental health disciplines. Additionally, we do offer training and consultations to health providers to enhance their understanding and skills in delivering effective mental health services to refugee and immigrants community. The other programs that we have in our clinic through partnership with CRISP and Rose Community Foundation is to conduct a wellness education sessions and outreach activities to enhance mental health services. Those include a mental wellness sessions target for Afghan families and youth to promote emotional health and resilience. We also do have a drug awareness and prevention sessions. This is also targeted in our Afghan population and focused educating adults and youth about effects of substance use. We also do community outreach, facilitating conversations and sessions within the community to provide mental health resources in our clinic and in the community. Part of the drug awareness and prevention, we do also have a professional training within the refugee mental health service providers that includes resettlement agencies and staff to provide substance abuse training for refugees to improve their skills and knowledge to support their clients. Our team that is facilitating this program are doctors, Dr. Rabil and Mubin, who is in the group today, who have a medical training in Afghanistan, connecting with the community culturally, and if you have any questions, please reach out. This is different sessions that we conduct actively in the community. If you have any questions related referrals for our mental health services and any other program, please just email me directly. We do have a referral form that I will be sending you back if you send me email to fill out and send us. So thank you so much for the opportunity to present our program. I will be here if you have any questions for any of our programs that I present.
So much, Fardoos. Thank you to our other presenters. I have no idea how we made it through 52 minutes and nobody has a question. I'm supposed to lead the questions segment and you all should not leave me hanging. So I am kindly requesting your questions